Okay.
Okay, good evening. I hope that you can hear me. So today we're going to be talking about natural treatments for diabetes leg pain. Okay. And before I begin, I just want to give a security warning that I would never call you to inform you about these sessions. Okay. So if anyone calls you telling you that I'm hosting a live session and you should read out a quote to them, please disregard them. And remember to put on your two-step verification on WhatsApp to prevent your account from getting hacked. Okay. So let's quickly run through the natural treatments for diabetes leg pain. Now, when someone is a diabetic patient, they would usually experience peripheral neuropathy, and your nerves essentially help you to experience the world. They help you with your circadian rhythm, they help you with your digestion, they help you with your involuntary movements. They also help you with your voluntary movements as well. Okay. And when someone is diabetic, when they have high blood sugar, it damages the nerves directly. It also damages the fat. There is a myelin sheet that covers the nerves that is made up of fat, and high blood sugar targets this fatty covering. Okay. And it also targets the blood vessel that carries food to the nerves. And this causes a dysfunction with the nerves. Okay. Now, the most common damage people complain about is what we call peripheral neuropathy, which is nerve damage in the hands and feet. It's usually worse in the feet. Now, your pain can be different. It can be a burning sensation, it can be tingling, it can be numbness, or it can be an individual being very, very sensitive to touch. Okay. Now, usually people have worse pain at night, and the pain can usually radiate from the feet higher up, and it can also make walking difficult and unsteady. So some people fall from time to time. Now, peripheral nerve damage increases if you have consistent high blood sugar or if you have consistent hypertension as you are growing in age, and if you consistently engage in drinking alcohol and smoking. So let's talk about some of the things that can give you relief. Okay, now the first is alpha lipoic acid. Now, this is the best studied supplement for nerve pain. It helps to break down carbohydrates so that your nerves can use them for energy. And it also helps to improve blood flow to your nerves as well. Okay. Now, because this alpha lipoic acid is so important, your body makes it, and you can get it also in red meat and organ meat like liver, and your spinach like ugu leaves, and your leafy vegetables. Okay. So you can take alpha lipoic acid in the dosage of 600 to 1,800 milligrams per day. And you can split that into 2 to 3 times a day. And remember to take with meals, because taking supplements with a meal helps you to reduce nausea, okay, and some side effects that supplements can give. Okay. Now, alpha lipoic acid also lowers blood sugar, so you want to make sure that you check your blood sugar often so that you don't have low blood sugar, because when you use alpha lipoic acid plus your anti-diabetic medications, then your blood sugar can get lower, okay, than normal. The next thing I have for you is curcumin. It is the active ingredient in turmeric. You may not get enough by eating so many turmerics, but you can get a supplement to give you good results. So if you are getting curcumin, you have the dosage of 500 to 2,000 milligrams per day. And you have to watch out as well, because curcumin supplements can interact with diabetic medications. Okay, so if you're taking curcumin supplements while you're taking antihypertensive medications, it can cause you to have nausea. Okay, you can feel like vomiting. Okay, now the next thing is omega-3 fatty acids. Now, this helps to reduce the damage in your nerves, and it also helps to strengthen the fatty covering of the nerve so that high blood sugar would not be able to damage the nerves. Now, you can have omega-3 in your mackerel fish, your sardine fish, your salmon fish. You have it in walnuts, and chia seeds, and flax seeds. But if you're taking it in supplements, you take 1 to 3 grams per day. Okay. Omega-3 is also likely to thin your blood. So if you are on antihypertensive medications, just watch out for omega-3 because it can bring your blood pressure further down. Now, some people complain about omega-3 supplements having a very fishy aftertaste. To fix that, you look for the enteric coated omega-3 capsules. That would help to target that fishy aftertaste that you do not like. Okay, so the next supplement is acetyl L-carnitine. Now, this helps the mitochondria of the nerve cell to work. Okay, and this would help the nerves to fire and also reduce pain. Now, you can take acetyl L-carnitine in the dosage of 2,000 to 3,000 milligrams per day. You can split in different dosages, but remember to always take with a meal. Acetyl L-carnitine can also interact with blood thinner medications. So you have to speak to your doctor before you get on acetyl L-carnitine. Okay. It can also have some side effects like stomach pain, nausea, and breathlessness. Okay. Now you have your B vitamins. There are so many B vitamins, but specifically B1, B6, and B12 are peculiar to helping you with diabetes leg pain. So B1 will help to convert the glucose into energy so that your nerves can use them to fire and communicate with one another. And your B6 would help to produce chemicals that help the nerves to send messages. And your B12 protects the covering of the nerves. Now, there are so many B vitamins, but you can just get your B vitamins as a B complex so that you do not have to take your B vitamins, in different capsules, okay? But remember that high dosages of vitamin B6 and B12 can cause you to have side effects, okay? Next, we have N-acetylcysteine. Now, this helps to reduce inflammation and damage in your nerves, and it also helps with pain. It helps the nerves to be less painful. Now, N-acetylcysteine is an antioxidant. It helps to remove chemicals that damage certain things in your body, free radicals, and it also helps to tackle oxidative stress. Okay, so you take N-acetylcysteine in 600 to 1,200 milligrams per day. You can take it you can split the dosage into two. Okay, and it can have some mild side effects like diarrhea, headaches, and nausea. But specifically, it is not suitable for asthmatic patients because it can make your asthma worse. Okay, so to tackle the side effects, just make sure that you take them with a meal. Okay, so the next supplement is magnesium. Now, magnesium prevents nerve overexcitement, and that is what causes pain. That tingling that people experience is usually as a result of nerve overexcitement. So magnesium would help to tackle that, as well as relax the muscles that are connected to the nerves that are firing. Okay, for example, the nerves and the muscles in your feet, magnesium would help to relax those muscles. Okay, so magnesium has been shown, studies show that many diabetic patients lack magnesium. The best types of magnesium to take with the most benefits are magnesium citrate and magnesium glycinate. So if you want to take them in supplements, please look for magnesium citrates or magnesium glycinates. And if you just want to eat your magnesium without taking supplements, you can find magnesium in your leafy green vegetables, your avocados, your legumes, your nuts, and your seeds. Okay. We also have astaxanthin. Astaxanthin helps your nerves to generate energy so that they can work and you wouldn't experience that numbness. Okay. You take astaxanthin in a dosage of 100 to 300 milligrams per day, but you have to take them with food as well. Okay. Astaxanthin is the most potent antioxidant that you can take that is known to mankind available today. Okay. So it is very, very good when it comes to helping you battle free radicals and oxidative stress, inflammation, things that damage your system. Okay. From free radicals basically come from what you eat and what you experience when you go outside, like pollution and the junk foods or the unhealthy foods that we consume. Okay, that's the work of antioxidants. So, astaxanthin also lowers blood pressure. So, if you are a diabetic patient who is also hypertensive, then you have to watch out for your blood pressure because if you are taking astaxanthin while taking antihypertensive medications, it can bring your blood pressure further down. Okay. Now we also have capsaicin. Now, capsaicin is the ingredient that makes your pepper hot. Okay. The work of capsaicin is to block the signal of pain in your brain. Okay. So it doesn't do anything when it comes to healing your nerves like the other supplements that I have mentioned, but instead, capsaicin works on your brain to block that signal of pain. Okay, so you can use it as a cream. If you're getting it as a cream, you just rub it on the affected area of your hands or your feet up to 4 times a day. Now, on first use, it may burn a little bit, it may hurt it may be hot on your skin for a little while, but it gets better over time. Okay. Now, with all these supplements, I do not want you to get all of them and then start using them. I would like you to just try one or two and see how it helps you. Because when it comes to peripheral nerve damage, it could be that your nerves themselves are damaged, or the fatty covering is damaged, or the blood vessel connected to that nerve is damaged. So you have to figure out what's supplement would work for you. But these that I have given you are the top supplements or natural treatments that can help you with your pain. Okay. Now, there are other means of relief aside medications. Some people use acupuncture or acupressure to help them relieve diabetic nerve pain. Okay, you can also try meditation or deep breathing and also walk because if you are dealing with peripheral neuropathy, it may seem as though you should rest more because of the pain that you're experiencing. But movement or exercise would actually help you with improved blood flow as opposed to you not exercising or moving around. Okay. So that is it. We have come to the end of this session, and I hope that this was helpful to you. If you have any questions, please just let me know. I would wait here for 5 minutes. And if there are no questions, you are free to go. Okay. Thank you for joining me live. Please let me know if you have any questions or comments or feedback, and I will respond to them. Okay. And if there are none, you are free to go. We are done. Okay. Okay, so I'll take it that there are no questions, but if you have any questions, you can just let me know on the WhatsApp group, or you give me you shoot me a text message or you call me, okay, and I'll attend to you. All right. Okay, so I'll stop recording now. Thank you for joining me live. I'll see you at a later time. Bye.